Counselling is typically non-directive, meaning that we don't tell people what to do. But there is a bit of a range in there. So for example, something like person-centered counselling is pretty much entirely non-directive. So client and therapist come into a room, the client starts talking about whatever they want to talk about, and the therapist follows that discussion and doesn't really tell them where to go or how to deal with it. They just serve up that mirror to help the client understand themselves better. Then there's a slightly more directive approaches to therapy. So something like cognitive behavioural, there might be, for example, homework, and the therapist and the client would agree, say, that exposure hierarchy, and then the client would go away and practice that between sessions. Or in mindfulness-based approaches, there might be some practicing of those mindfulness skills. And across all of these approaches, we're probably going to want some therapeutic goals. What is the client looking to get out of this? And that will involve the counsellor and the client agreeing what those goals are. So they're very much client-led, but there may be some input from the counsellor depending on how appropriate those goals are. For example, if you're looking to never have a worry again, that's probably an unrealistic goal for counselling, and the counsellor has a duty to point that out and help the client develop a more realistic goal. So even in these cases, it's very much a partnership where the counsellor and the client agree what to do together. So it isn't the case where you say you go to your doctor and your doctor says you have to do this. The client and the counsellor will agree what to do together, and then on the non-directive side, it's entirely client driven.